Hello, everybody. Welcome to another episode of Ask Dr. Bob Some Tremendous Questions. We have someone who was about 7 years old and was concerned about wrinkling skin and thyroid glands. So here's what my thoughts. What's going on probably more than anything is female hormones. There's a term called glycation, which is when sugar and protein come together, that can cause wrinkling skin. But I also know, being at 7 years old, hormones have a lot to do with it, especially low estrogen. Thyroid meds, because you went into great detail about your taking thyroid meds do not cure a thyroid problem. They help manage it. The best thing for you to do is drink lots of water, eat protein, but you want to stay away from sugar-protein combos like yogurt or ice cream because it causes inflammation. I learned that from Dr. Nick Perricone in his book, The Wrinkle Cure. This is a detailed question about someone who's having floaters after they had angina, saw on our website about carrots and floaters. Carrots will help floaters that may have something to do with maybe when your liver is compromised, usually in 4 or 5 weeks, up to 6 months. I have seen so many floaters go away. But if you have angina, that changes the whole scenario. That means you have some vascular inflammation, and yes, the back of your eyes could definitely be impacted. I would focus on some vitamin C for sure. Red, yellow, and orange bell peppers would be great. I talk about this in Dr. Bob's Guide to Prevent Surgery about scurvy and iodine. I read an article in the Well-Being Journal about scurvy and blood vessels. Vitamin C would be very important. Dr. Bob, I have vertical ridges on my fingernails. What I have learned about vertical ridges, it's usually an adrenal fatigue issue. The adrenals move iodine. The adrenals move minerals. So you might consider Celtic sea salt, increasing your minerals. Obviously, you're going to want to back off on all of your activities so you're not as stressed. Somebody asked a question about how can we treat schizophrenic challenges without drugs. In our practice, we use a vegetable-based product called L-Izyme Forte. I am not going to sit here and tell you that we are going to cure individuals with schizophrenic issues, but we've had great results with a lot of major anxiety with L-Izyme. Dr. Bob, I went through menopause early. I was around 50 years old. I noticed that my skin was thinning, wrinkles, muscle tone. This goes all the way back up to 70-year-old. That's why I wanted to bring this in. It definitely is hormonal. See, in the human body, and we talk about this in Dr. Bob's Drugless Guide to Balancing Female Hormones, is your adrenal glands are your backup. So as a woman goes through menopause, those adrenal glands are secreting the hormones that your body needs to have you walk through this. You know, skin has a lot to do with collagen, water, vitamin C, sulfur. You want to be eating red and yellow, orange bell peppers, eggs, onion, and garlic, broccoli, cabbage, water. You don't want to be eating sugar. Sugar and cigarette smoking will definitely cause wrinkling. Is there a cure for trigger thumb? Well, I want you to know I don't ever like to talk about cures, but I can tell you from my experience, vitamin B6 definitely helps tendinitis. Question about osteoporosis. What we have learned with osteoporosis, it has a lot to do with stress also. I talk about this in Dr. Bob's Drugless Guide to Balancing Female Hormones. I have a whole chapter on osteoporosis. See, when your body secretes cortisol, your adrenals, that cannibalizes muscle, and then the muscle has phosphorus, which takes calcium from bones and teeth. I talk about this also in great detail about Dr. Bob's Guide to Prevent Surgery. Yes, we have products. I would encourage you to have your vitamin D tested. We use a liquid vitamin D. You want to stay away from sugar. My daughter is 15 years old. She's losing hair and weight. So there could be something going on if your daughter is anorexic. Is she bulimic? She was definitely hormonal. You know, does she have a boyfriend issue? There could be definitely something emotionally going on in her life. Dr. Bob, what are the best supplements for chronic fatigue? Probably the best thing for chronic fatigue is back off all the activities that you're doing. Get to bed at 10 o'clock. Stop eating sugar and fruit. take Celtic sea salt, B vitamins, red, yellow, and orange bell peppers, and minerals. Red, yellow, orange bell peppers, great source of vitamin C, minerals, protein, B and by 10. I'm going to give you a statement. When somebody asks you to do a lot of activities and you just don't want to do it, just say, I can't say yes. That's a loving way to say no. I did a Facebook Live recently. I talked about thyroid, and I want to clarify this. When somebody comes in their office and they have high cholesterol and normal triglycerides, as I stated in that Facebook Live, that's usually stress. When somebody has high cholesterol and high triglycerides, they have a poor diet. Now these could be intermatched with each other, but thyroid has a lot to do with high cholesterol, low thyroid, high cholesterol. But when those triglycerides are high, I know you're eating a lot of carbs. 30 years old, hand, foot, and mouth disease, caught it from your toddler. Well, first for yourself, your immune system is probably compromised. Do you eat sushi? Have you been to a third world country? Do you have a cat? You may have parasites. Your immune system is compromised. We actually use a citric seed extract in our practice called Agrecept L with great success. Dr. Bob, I have rapid heart rate. Usually the best solution from that, from our experience, is magnesium. Kale, anything green is a great source of magnesium. It'll help hopefully slow that down. Your body is starving for minerals. We had a question from Pakistan. This individual wanted to know about parathyroid issues and what to do in that arena. I can tell you from my experience, and we don't see a lot of parathyroid patients per se in the United States, but what I really have come to find out, a lot of parathyroid issues is actually a lack of vitamin D. If your D is low, your parathyroids are going to rebound in a different way. We use a liquid vitamin D. I take about 4,000 units on my tongue every day, and I'd encourage you to do the same. Very last question. How much iodine should you take for cancer? Well, you know, we don't ever really like to talk specifics about any condition, but I can tell you this. I take about 12 milligrams of iodine every day. The most scientific way to determine how much iodine you need is a urine iodine loading test. That's a test where for 4 or 5 days you take no iodine, then we have you do a pre-test, then we have you take 50 milligrams of iodine. For the next 24 hours, you catch that urine. The lab will tell us how much iodine you excreted out. You should excrete out about 95% of that. Most of the people in our practice secrete at about 35%. That means they're holding on to about 60%. Okay, so what's happening, their levels around 62%. They've excreted out quite a bit because what's going on, you want to excrete out 95%. So they're holding on to some. So the urine iodine loading test is the best way to determine how much iodine you need. Tremendous questions. We'll see you next time.